there everyone. We're going to do a series of short films this morning, and what we're going to do is we're going to look through all the different insoles in the Bio range. So we've got the Bio Advanced, Biomex, BioSkyve and BioSoft. And what I'm going to do in these short videos is just run through the features of the device, and we're going to look at some of the different things that we can do with each of them and perhaps some of the conditions we could treat. So first off this morning we're going to look at the Bio Advanced. We're looking at this one first because this is by far the most popular device, and that's really because it's so versatile. So you've got 6 in the range and they're nicely colour coded as well, so you can tell the difference. The orange ones are high density, the grey ones are medium density, and the purple ones or the lilac ones there are low density. Now we can get them in full length or 3/4 length, and they all come with additions as well that you can stick on. So if we look at some of the specific features, I've just picked up the high density full length one there. Got a nice deep heel cut, got a good valgus support here, a little bit of metatarsal support, and then underneath we've got some nice little pull out areas here which you can use if you want to dissipate pressure, or if you've got a patient with a hallux limitus or something where you want that extra range of motion. Also removable dowels in underneath the heel, and we've got some extra ones in the pack that you can replace with if you need to. Now, like I said, these are very, very versatile, so you could just stock all of them and use whichever ones you'd want for specific patients. So for example, with the soft density ones, these might be better for older patients or those who have less range of motion, or something you just want a little bit more cushioning for. But they don't tend to last, or they don't have quite the same longevity because they are soft density EVA, but that is the purpose of that. Medium density is probably the most popular, and this you could just use for a wide variety of conditions, for a wide variety of patients. It's just your good all-rounder one really to have stocked in clinic. And then high density, not everybody tolerates this, but if you've got heavier patients or those that you need more biomechanical control with, then this is the device you probably want to be using. Now you can use them just exactly as they are, stick the additions on. As I say, they come already with a 4-degree intrinsic post, but you've also got additional posting in the pack there, so you can add more to it, or forefoot posting, or heel raises, or whatever you want to do. If you like fiddling about with your devices, if you want to make them a little bit more bespoke and you're not afraid to try different things, then there are various different things we can try with that. So you can heat mould them. There's an area underneath the arch here, and that says heat indicator on it. I mean, you could heat mould it anywhere, depends how confident you feel with a heat gun. Do remember, if you haven't used a heat gun before, I would probably try and practice first on a pair of devices that you're not going to give to a patient, and don't do it in front of the patient. But once you're used to doing it, very simple to do. Make sure you've got your gloves on, your hair tied back, and then it's simply a case of just moulding underneath the arch there. Now I'm not going to leave that on because you won't hear me talking, but what you can do is you can push up more underneath the arch, so if you want to give more contact to the foot, or if you've got a patient with a very valgus foot type, a very flat foot that doesn't have a lot of mobility, you might actually just want to be pushing that arch out. Also, if you want to make it more total contact, if you've got an at-risk patient, perhaps you'll heat mould the whole thing and you'll get them to stand on it once it's cool enough, and then it will mould more to the patient's foot. So you've got a lot of versatility that you can do with that. The other things, depending on what you like with a pair of scissors, now if you like cutting and snipping and you've got lots of things in your clinic like semi-compressed felt, pour-on, my tip here is definitely use a sharp pair of scissors, because if you start messing about with blunt scissors, then your device doesn't look good and you make it harder on yourself as well. If you didn't want to stock the whole range, then you could maybe just have the full length ones, and then when you want to have a 3/4 length device, you can trim accordingly to that. If you want to trim it down, trim a slight angle with the scissors, and then you get a little bit of a bevel on that distal edge, so your patient won't feel a huge drop. Now obviously you look at that and you think, well, that's the same I've done to the 3/4 length there, what's the point? But you might want to do your own additions on there, so perhaps you want to do a first ray cutout. There we go. And I know some clinicians as well like to take bits out of the 5th ray, or they like to do different things along the distal edge to try and pop up the metatarsals. So all of that you can do just with a sharp pair of scissors, but do try and bevel that and keep it at an angle as you go. You can stick on your own Met domes or Met support pads. You can, as I say, place them on easily enough. or there's quite a few things you can do just with a bit of semi-compressed felt. So one thing that I find works quite well is you can make a small little thing like this just with maybe 6mm semi-compressed felt, and if you stick it underneath the sus denticulum tali there, that gives you more support if you've got a patient which is hard to control, because it pushes up on that area that tends to plantarflex as the foot pronates. Again, you can do all sorts of forefoot additions on there as well. So, as I said, they really are a versatile range. You can dish them out as they are, or you can do as many adaptations to them as you want. But definitely a great thing to have in clinic to use on pretty much any patient that you think requires an orthotic device.